of cancer patients would be at risk for infertility this year. Dr. Hickman from Memorial Hermann Memorial City is with us again, along with Angelica Garza, to talk about the risk cancer patients face when trying to conceive. Good morning.
Good morning.
So, getting diagnosed with cancer is enough, but if you haven't had your children yet, that's just like a double whammy.
It's very difficult. It was the hardest thing. You're like, okay, you found out you got breast cancer, and then the next thing you know, your whole life breaks down, and you're going, what do I do? So I pretty much did some research, and I had wonderful doctors along the way to help me. And before my surgeries and everything, I searched out Dr. Hickman, and he set me straight and helped me see the process and everything. And then I had my surgery. We did the egg retrieval, did the embryo frozen, and then I went through radiation, and then came back to Dr. Hickman, and now I'm 3 weeks pregnant.
Yay! 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 So obviously, the thing here, Dr. Hickman, if somebody is going to go through cancer treatment, to come in first before all that stuff starts, because that can be very difficult on the body.
That certainly is best if one can. You know, sometimes cancers don't allow that.
Yeah.
They're just so aggressive it's not possible. But thankfully, in this situation, we were able to go through a situation, talk with the oncologist, talk with the surgeons, work things out so that we could retrieve her eggs before she was going to go through these damaging radiation therapy treatments.
So the rest of like the uterus, all those things are fine after these radiation treatment. It was just that the eggs can be damaged.
Well, you know, eggs are very, very susceptible to be damaged by chemotherapy, radiation, things like that. Just like men's sperm also could be damaged in that way. So the uterus is more resilient than that organ. So in other words, typically, yeah, it will survive, but eggs often will sometimes be lost. So that's why we had to make sure we could secure those healthy eggs before they were exposed to these agents.
Yeah, and it's like they say, if you are someone who you get pregnant, to make sure you have that mammogram before you get pregnant, because cancer and breast cancer, or breast cancer and pregnancy, don't go together well.
Right. Certainly many of the breast cancers are estrogen receptor positive, and therefore they can grow during pregnancy and be manifest. So yeah, absolutely. Before you get pregnant, get things checked out, make sure your pap smear is normal, mammogram if you're in the right age, and so forth before conceiving.
Congratulations. I cannot tell you, congratulations, how happy I am for you, because the first beat breast cancer, but then to come back and have that baby after all, that's amazing. 90% of people in childbearing age can deal with fertility issues after cancer treatment.
Yeah, it's tough. Like I said, those eggs can be damaged, and so there are many things that can be done. Now, the best thing we have is really to create embryos beforehand. There are other things that we're kind of dabbling with. They're really still experimental, like freezing eggs, freezing ovarian tissue. But just a handful of children have been born from that worldwide. So freezing embryos really works quite well.
Thank you very much. You can find out more from Dr. Hickman at memorialhermann.org. We'll be right back.